have actually arisen during that period, giving a 14-day incidence of 3.84 per 100,000 population. Of these 183 cases, the median age is 39 years of age, and 58% are less than 45 years. 96 or 52% were in males, and 86 or 47% were in females. 42 or 23% had underlying medical conditions. 61 cases or 33% were in healthcare workers. 116 or 63% of cases were in Dublin, with 14 or 8% in Kildare and 10 or 5% in Cork. The remaining 43 cases were spread across 18 different counties. In relation to clusters, there have been a total of 471 across all residential care facilities, of which 267 have been in nursing homes. These clusters have been associated with 7,485 confirmed cases to date across all residential care facilities, of which 5,862 have been in nursing homes. There have been 1,114 deaths associated with outbreaks in residential care facilities, representing 63% of all deaths. And of those, 991, or 56% of all deaths, have been associated with clusters in nursing homes. There are currently 14 confirmed cases of Covid-19 in our hospitals, and 6 confirmed cases are in critical care. So I'll now hand over to Professor Nolan to give us an update from his work with his group, and then we'll take some questions.
Very good. Thanks, Ronan. So this week, as with every week, we're looking very carefully at some key indicators of the prevalence and severity of the disease in Ireland. One of the most important indicators in recent weeks has been the average number of cases confirmed per day. For the last 4 or 5 weeks, that has been rising. And this week, it seems as if we have achieved some level of stability just in the course of the last week, so that on average, for this Wednesday, looking back over the preceding 5 days, on average, we were confirming 18 cases a day. Last week, that was 19 cases a day, and it had risen to 19 over 4 weeks from 9. So all other indicators of more severe disease, the number of people in hospital, the number of admissions to hospital per day, the number of people in intensive care, all remaining very stable or in some cases even declining, and the rate of admission to intensive care remaining low at a level of about 1 admission every 5 days. We have been confirming on average 1 death per day, but as has already been alluded to, many of those are delayed notification of deaths that occurred sadly in recent weeks. If we look at deaths by date of death, there's really only 1 death every 3 to 5 days occurring at present. So on that key metric, looking at cases confirmed per day, which has been rising for several weeks and now appears to be stabilising, that's positive news. We're seeing that against a background of a very strong testing regime. So we continue to test at very high levels, on average 7,500 tests a day up to last Tuesday. And the positivity rate is very low indeed by international standards, and even dropping. So only 0.25% of tests reported in the 5 days up to Tuesday were positive. Looking very closely at the daily and weekly case counts, you can see going back to early to mid-June, we were seeing fewer than 100 cases per week and very small numbers per day. So the grey bars are the daily case counts, and the red line is the 5-day moving average. Late June into early July, the number of cases per day and the 5-day moving average started to increase. And then if you compare the first 3 days of this week with last week, and in particular the 5-day moving average, you can see it seems to rise up until the 12th, 13th, 14th of July, and then to stabilise. We can see, if we look back over the entire pandemic in Ireland, and just carefully noting that this is a logarithmic scale on the y-axis, you can see that upturn in cases beginning towards the end of June, having had decreases since late April, And again, if you look particular at the dashed blue line, which is by date of confirmation, that increase, which was happening from late June until around 12, 13, 14 of July, now seems to have stabilised. Again, the 14-day cumulative incidence are our best indication of the level of active infection in the population, decreasing to a low in late June, increasing late June, early July, and that rate of increase seems to have tapered off. And it's very early days to be drawing those conclusions, but it is a positive note that the numbers this week are similar to the numbers last week, not an increase on last week. Where these cases are rising, we're obviously watching that very closely. Very low incidence of the disease in long-term residential care settings at the moment. So the proportion of cases less than 2%. A decreasing proportion of cases in healthcare workers compared with recent weeks. And of course, you need to remember that we're actively screening healthcare workers in long-term residential care. In the last several weeks, we've seen a re-emergence of outbreaks in various settings that have been mentioned in previous discussions. That proportion seems stable, and a lot of cases remain as sporadic or isolated cases or in private households or extended family settings. So almost half the cases in the week up to last Sunday were in that setting. Equally, how is the virus being transmitted? It's important to see in this, so this is looking right back to the beginning of the pandemic, the various modes of transmission of the virus, what proportion of cases are attributable to the different modes. Looking back on the week to last Sunday, it's important to note that a lot of cases are associated with close contact with an already known case. And that's a good signal that our test and trace system is detecting cases early. There's still a significant level of community transmission, a reduced level of nosocomial or in healthcare setting transmission, and equally, if you look at last week compared with the preceding weeks, a decreasing level of travel-related transmission. It's still significant, but it's less than it has been in the preceding weeks. And the absolute numbers of travel-related infections bear that out, 20 in the week up to last Sunday. So this sense of stability in case counts should be reflected in a reduction in the reproduction number. And as I repeatedly say, it's very difficult to estimate under these circumstances, but nonetheless, it does look like the reproduction number has decreased this week compared to last week. Just to say that using mathematical models to estimate reproduction number is very difficult under these circumstances, so we know that our model-based estimates are out. The population model inferred estimate, or SEIR inferred estimate, we know to be too high, but it's interesting to see at 1.79 it's lower than last week. The imperial model, which infers reproduction number from the number of deaths, is an underestimate because the number of deaths are so low, which is a good thing. So we know that that's low at 0.77. Our statistical estimates of reproduction number are better. When we look at the time-dependent reproduction number, just a caution, that's really taking the cases from 2 weeks ago and looking at the number of infections they probably caused last week. So that estimate of 1.4, 1.32 probably relates to what was going on in the last week. Our up-to-date estimates of reproduction number suggest that it was in the region of 1.2 last week. So our estimate of reproduction number for last week, with the additional data we have, is between 1.2 and 1.4. Our estimate this week is that it's just a little bit above 1 at 1.1, but it could be as high as 1.4. So the best interpretation of this data is twofold. First of all, we have a sense of stability in case numbers, but it's very early to tell. We need to see this going on for another week or 10 days before we'd be comfortable saying that we had arrested the increase in cases we've seen over the preceding 2 weeks. But the best interpretation is that people read the signals, they understood that case numbers were increasing, and they individually recognized that and took extra measures to ensure that in going about their daily lives they reduced the transmission of the virus, and that we're seeing that translated today into a detected decrease in reproduction number. That's good news in that we seem to have reduced transmission of the virus, but it should also start to encouragement. It won't stay that way unless we maintain this effort. So it's strong encouragement to continue those efforts to interrupt chains of transmission, and then as a consequence bring the reproduction number back down below 1 and to begin to see a decline in the number of cases that we're reporting day on day and week on week. Thank you very much.
Shane.
Hi, Shane Beattie from News Talk. For parents who'll be listening to this news this evening, I presume a lot of them will be encouraged that we've taken steps as a country in recent days. They will be wondering, because you've said, I think I'm right in saying you said opening schools is the number one priority or the main priority or one of the main priorities. We've heard today from the Taoiseach, Leo Varadkar, saying that there's no reason why Ireland should be the only country in Europe that doesn't reopen schools at the end of August. Is that fair? Is there a reason why we could be the only country in Europe that doesn't open schools at the end of August?
It's very fair. We have 3 priorities. We want to get our healthcare services back up and running to the greatest extent possible. We need to protect the most vulnerable in society, and we need to get our children back to school. And all of our efforts need to be focused on those 3 aims. As things stand, we're absolutely on track for children to go back to school in September. But as the WHO have said, and as we've said repeatedly, the single greatest predictor or determinant of all of those 3 priorities is community transmission, and the extent to which we continue as individuals to adopt all of the behaviours that we talk about and keep this disease at the levels that it's at now, or indeed a little bit better than where it's at now. Ideally, we need to get this back below 1. We need to suppress this disease back down to where we were a couple of weeks ago. And it is early days. It's absolutely early days. But last week we were uncertain and worried. The week before we were uncertain and pessimistic. This week we can be uncertain but optimistic. And what it demonstrates is that people listened 3 weeks ago. They listened 2 weeks ago. They've taken actions at an individual level. And if anyone is in any doubt of the effect of their actions, hopefully the positive message this evening will show them that each of us as individuals and what we do each day does make a difference. And we need to keep doing that, particularly over the next 5 weeks, to achieve that aim of getting all of our children back to school.
And if parents hear that it is such a priority, the pubs could open in 2 weeks' time, and some parents will be saying, why don't we get our children back to school first, see how that goes, and then reopen the pubs? But as it stands, the pubs are due to open 2-3 weeks before schools reopen.
So that's obviously a legitimate viewpoint to hold clearly, and it's in keeping with our overarching priorities. What I would say in relation to the pubs is that it's simply too early to make a determination. What we're seeing this evening is positive, and it's a positive message that we're getting out there. But it is the start of something positive, and we need to see it continue in the same way over the coming weeks. And the decisions or recommendations that we make around pubs will be most appropriately made in a couple of weeks' time, not today.
Just 2 other questions. We've seen another case today at a construction site in Dublin. Are you looking at changing advice that we give to the construction industry about social distancing and measures that we have in place, specific advice changing for construction sites?
So there's no plan to do that at the moment. There is, I think, very robust guidance there. There's no suggestion that anything went wrong here. We've always known that as we open workplaces, that as we open society back up, there will be clusters in a variety of settings. And the message is really, as I said on Monday, regardless of the setting that you're in, whether it's a workplace, a restaurant, whether you're at home, try to follow the public health advice, stay physically distant, and don't drop your guard.
And just one final one, we saw in a report today that counties where a lot of people are likely to go on a staycation, places like Kerry and Sligo, have seen a rise in COVID-19 cases. Are you detecting any concerns about areas where would be popular with staycations that we're seeing increases in cases?
Not so far. The patterns of transmission and the regional patterns, I suppose, have not changed to any substantial extent over the past number of weeks. But it can be fully expected that as people move around, the patterns of disease will move with it. The disease moves with people, and so the more movement there is, the more likely it is that disease will get seeded in other places. But that's on the background of very low levels of disease within the community. So hopefully it won't result in problems. But the greatest guarantee of it not resulting in problems is that if you do go on your holidays in Ireland, you continue to take the precautions that we talk about. And again, don't drop your guard just because you're on holidays.
Perfect, thank you.
Dr. Glynn, hi, Simon Cars with the Irish Times. Do you think that schools should reopen before pubs?
So we've been very clear about our priorities. NEFIT doesn't make either or recommendations. We look at the evidence, we look at the disease, and we make recommendations based on where we're at a point in time. And of course, the overarching priorities will be part of our considerations when it comes to making recommendations in 2 weeks' time.
You're saying that you're absolutely on track for the schools to reopen when the school year gets back. Are you fearful that reopening the pubs will knock that off track?
Pubs are one of the highest risk environments. There's no getting away from that. It's the reason that we paused last week when we were concerned about the disease. I think we just need to look at where the disease is at in 2 weeks' time. We need to ensure that any further reopening is done in the safest possible way. And clearly we want to get society back functioning as normally as possible, but it needs to be done in a really safe way. And certainly we can't do anything to jeopardise the overarching priorities, whether it's healthcare services and the work of the HSE, whether it's schools, or whether it's protecting the most vulnerable.
You'd mentioned the other day, on Monday, that there's more than 20 cases on that one construction site that was referred to as having an outbreak the other day, but more workers are going to be tested. Do you have any up-to-date figures as to how many cases were at that site, and also at this new site that's been identified?
So my understanding is that the second site just had a case in a person who was connected to both sites. My understanding, and I wouldn't have full information at this point, my understanding is there's not a cluster at the second site, and that site is closed out of an abundance of caution, pending further risk assessment with the public health team. In relation to the first site, I believe it's somewhere between 25 and 30 cases, so it hasn't increased very substantially. But 25 or 30 cases in any setting is substantial, and again demonstrates the extent to which this disease can and will spread if it's given any opportunity.
You'd mentioned there, finally for me, that this week we can be uncertain but optimistic. If there was one area of concern for you, what would it be?
So the single biggest thing that I see day to day, and that others report and we see when we look on TV, is that people, I think, are forgetting to physically distance. This virus can only transmit when people come into contact with one another, and it's completely understandable that as things have improved, people have dropped their guard in relation to that. So if there's one message that I would get out there in terms of the behaviours that we promote all the time, it's to just keep thinking about that distance. I know it's not easy, but keep that space between yourself and others. I don't know, Dr. Henry, if you...
If I could add, Dr. Fauci, who we all know from the US, has added to that there is a sense among some younger people that they're invulnerable to this, and while some people's behaviour has changed, the virus hasn't. And so one of the causes of concern for us collectively has been the drop in the median age of people who've contracted the virus, and to some extent also the reluctance of some people, to come forward for testing once they're deemed to be a close contact. And while people may have their individual reasons for doing that, it's important to remind everybody that we know more and more about the mode of transmission of this virus. Dr. Fauci himself said that in his 40 years of dealing with viral outbreaks, he's never come across a virus with such a transmission pattern, particularly among people who don't have symptoms, of upwards of 20 or 40%. So we know from that from those close contacts that even in asymptomatic individuals, people with no symptoms, that 7% or so on day naught are positive for the virus. And for those people who don't come forward for testing, it's possible that they may act as a source of a new outbreak, because and given the number of contacts are greater for younger people, upwards of in a very young age group, not just the average of 5, but pushing 8 or 9 in some cases, that can lead to not just one person, but then exponentially an increased number of people. So the other source of concern for us, not just here, but is this sense of invulnerability that people have to the virus. It hasn't changed. Its nature hasn't changed how deadly it is among vulnerable groups, and it hasn't changed how transmissible it is.
Thanks very much.
Thank you. Conal Thomas in the Journal.ie. Dr. Glynn, I just want to ask you about the report today in relation to follow-up calls for people coming into the country. It was reported today there was plus 60,000 people came in between the 1st and the 15th of July, and there was just over 4,000 follow-up calls made by the BMU. Now, obviously, their kind of core thing is immigration, and they're awaiting the handover of that process to the Department of Health. Firstly, are you satisfied with that level of follow-up? And secondly, what stage is that process at?
So my understanding is that there's a process going on across government to make that more robust. There'll be a much enhanced call centre. There'll be much enhanced processes around ensuring that people are followed up. I'm sure it'll take a couple of weeks for that new process to be scaled up and put into place. So could it be improved? Clearly it could be improved. But ultimately that would be just one piece of the picture. And again, that's one piece of it, but ultimately it comes back to what each of us does. So if each of us here in this country, in our interactions with other individuals, are doing the right things, that is the single greatest determinant of whether or not this disease spreads.
Just on today's delayed deaths, I just want to clarify, it was April, May and June they occurred, is that right? Can you give us a bit more detail on where those deaths occurred and what the cause of the delay was?
I can't give you more detail on where they occurred. So there's 2 ways in which deaths get notified into the reporting system that we report. So the first is that our public health doctors are aware of them as part of their work and they notify them into the system. The other is that the General Registrar's Office becomes aware of them when people notify the office. In this case, these deaths were notified to the General Registrar, and you have up to 3 months to do that. So it's not that there was anything out of the ordinary. They were notified the General Registrar's Office, in turn notified to the Departments of Public Health, who've reported them up to ourselves. So this is not unusual, but I suppose it does give us an opportunity again to ask families and loved ones, and I know it's a particularly difficult time, but whilst you have 3 months to notify, clearly we want to know about these deaths as soon and as quickly as possible so that they can feed into our decision-making processes.
Just 2 more quick ones from me. One is in relation to the COVID app. Just wondering, do you have any figures yet for if you've traced clusters to that, or do you know when you will have figures?
We haven't figures yet. We know that there's data coming through. We don't have specific figures, but we can bring that through to the next briefing.
Great. And finally, do you have the updated figures for residential settings like direct provision and Roma community?
I don't have them with me, but to my knowledge there was no new clusters last week. There was 1 additional cluster in a direct provision centre notified, but it was a historical cluster.
Okay, thank you.
Hello, good evening. Just on the pause in going into phase 4 last week, was obviously, you explained it had to be a preemptive strike. You couldn't wait to see the numbers coming in the weeks ahead before you paused. Having seen this week's numbers then and the trends, the positive trends in those, does it look like that worst case scenario hasn't materialised?
As of yet, of course, the worst case scenario hasn't materialised. We'd be at 2.5 times the number of cases today that we are if the worst case scenario has materialised. But I think it's also important to emphasise that the These data are always noisy, that you can get increases one week and decreases the next week. So it is going to take a little bit more time before we can say with any level of confidence that we've had an increase followed by a period of stabilisation. And of course, what we're really looking for is a period then of decrease, that we get back to the position that we were a few weeks back, because what we need is case numbers very close to zero in order to enable us to do all of the other things that are priority things to do.
Is that not kind of more or less what that chart is showing? Case numbers very close to zero?
Well, we were down below 10 as a daily average new case confirmation, and we're now still at an average is slightly above 20. So it shows it increasing, and for 1 week only so far, stabilising. And that's, I think Dr. Lynn has put it perfectly. Uncertain and optimistic is precisely the position to be in here. But we need to see what happens. We need to see that seen through over a week or two before we can say we have a handle on what the disease is doing.
But if it was to stabilise around where it is now, you wouldn't envisage any threat to phase 4 on August the 10th as it stands today if you had those trends?
So I think we'll have to look at the trends in the round at that time. It is a positive picture, and I'm conscious that most evenings we come in here, it's a negative picture, and I know people get very tired of the warnings and the negativity. This evening is a positive picture, but we do need further improvement. As things stand, we think the reproduction number is still above 1, which means that the virus is increasing in our communities. We need to get it back below 1. And as Professor Nolan said, we need to see the trends decreasing back down. We're in a really good position, but ideally we could get that with a little bit more effort. We can get it to a place where it's decreasing right back down again, and that would obviously give us very significant headroom and very significant confidence going into a period where we want to reopen schools in particular.
Just given, I think on Monday, even the spectre of reversing back into phase 2 was not ruled out. But I mean, is this kind of response to the spike in last week's cases telling us that people's actions, behaviours is really the way to fight this now, not, you know, extreme lockdown measures like going back to 5-kilometre restrictions?
So I think perhaps my comments in relation to that were slightly misinterpreted. There was certainly no intention as of Monday to contemplate going back to a phase 2 scenario. But we can never rule something like that out, unfortunately. We are in the middle of global pandemic. But to your specific question, since day one with this process, the key measure or the key measures that will dictate where we go with this are people's individual behaviour. And hopefully we don't require additional measures over and above that. Unfortunately, we've seen internationally in the last number of days, Austria, Spain, Belgium, the Netherlands, all reporting increases in cases. Belgium were supposed to move forward with easing today. They didn't. So it is not unreasonable to expect that we will run into trouble at various time points. But as we've seen, thankfully, people so far have responded to our calls for redoubling their efforts, and hopefully we're seeing a stabilisation and hopefully, in fact, an improving trend. Hopefully we'll be back here in a week's time and be able to say that things have actually improved week on week.
Okay. I'm sorry, just finally on the positivity, the testing rate, positivity, you said it was good by international standards. Is there any reason or anything you can read into that, or why it's so low? Is it to do with the regime, or who's been tested, or the type of testing? Or?
I think what you can read into that is by international standards, we're testing a lot of people, and the prevalence of the disease is low, and therefore we're getting very few positive tests back. So I think it's a sign that broadly speaking, even though we're going through a bump at the moment, we are looking at an overall background of low prevalence by international standards and a very high testing capacity and deployment of that testing.
It doesn't tell us anything about the transmission from people. It just seems like the young people have higher numbers of contacts we're hearing, and yet the R number is still quite low and the positivity rate is low. I don't know if I'm interpreting that correctly. Does that, I mean, are people not passing the disease on to as many people as you might expect?
Just if I could come in there, we've tested over 350,000 people now, and if you think back to a couple of months ago, when we were testing very low numbers because of all the problems we had with the testing pathway, the reagent and the swabs and so on, we hit positivity rates over 20%. So testing over 50,000 people the past week, a positivity rate of 0.2% shows how much we have been able to suppress transmission in the community. So it is a remarkable achievement due to the efforts of everybody in this country. But as has been said earlier, to allow ourselves to open up our schools, to open up our health services, which I'm primarily concerned with in the HSE, is we must maintain that really, really low level of community transmission. It's the greatest protector and the greatest enabler of us opening up education, health and society.
Thanks.